All right, welcome to The Explainer. Today, we're going to talk about a four-letter acronym that honestly might be one of the most important things you've never heard of when it comes to healthcare in India. I'm talking about NABH. So, what exactly is it, and why is knowing about it so critical for your safety? Let's dive in. I mean, think about it for a second. Let's say a loved one needs care, and you're faced with this huge list of hospitals. How in the world do you choose? I mean, beyond a fancy lobby or, how close it is, how do you really know which one is truly safe? In a healthcare system as massive and diverse as India's, wow, that's a tough question. And you know what? That is the exact challenge NABH was created to solve. Because before it came along, India's healthcare system was kind of like the Wild West of quality control. You had these absolutely fantastic hospitals, sure, but they were right alongside others with, let's just say, questionable standards. And for the average person, there was just no reliable way to tell them apart. There wasn't a single trusted measuring stick for what good actually looked like. So the answer that emerged was NABH. That stands for the National Accreditation Board for Hospitals and Healthcare Providers. It's part of the Quality Council of India, and its mission is, well, it's simple, but it is massive, to establish a gold standard for quality and safety that any healthcare organization can aim for. And listen, this isn't just about ticking boxes on a checklist. Not at all. It's about building a whole new culture of quality. Think about it. NABH is what pushes hospitals to make sure that whether you're in a big city like Delhi or a smaller town, the standard of care is consistent. It's there to champion your rights as a patient, to demand that treatments are backed by real science, not just how we've always done it. And maybe most importantly, it encourages this mindset of always getting better. The end game here, it's to build that unshakable trust between you and the people taking care of you.
Okay, so this brings up a really crucial question, one I hear all the time. People ask, wait a minute, doesn't the government already license every single hospital? And the answer is yes, absolutely. But here's the thing, a license to operate and an accreditation for excellence are two very different things.
So here's the simplest way to wrap your head around it. A license? That's mandatory. It's the bare minimum, right? It's the legal permission slip just to open your doors. But accreditation? That is completely voluntary. It's a hospital putting its hand up and basically saying, hey, we want to be held to a much higher standard. Please come in and scrutinize everything we do, from the operating room to the front desk, against the toughest benchmarks out there. So here's the bottom line, the key takeaway. A license means you're allowed to be in the race. NABH accreditation, that means you've won the gold medal. It is a choice to be a champion of patient care. So we've established it's a really high bar to clear. But so what? What does that actually mean in the real world? Why should you, as a patient or a doctor or even a hospital manager, actually care about this? Well, let's break down the benefits for everyone involved. For us, the patients, the benefit is really simple. It's confidence. It's that confidence you get from knowing the hospital has proven tested procedures to minimize things like medical errors and infections. It's knowing you have a right to clear communication and that your treatment plan is actually built around you. In a nutshell, it's peace of mind, right when you need it the most. And what about for the hospitals themselves? Well, this isn't just about having a shiny certificate on the wall. When they implement these standards, it creates this incredible chain reaction. You see, standardized processes, they lead to better clinical outcomes. And better outcomes, they lead to happier, more satisfied patients. And of course, happier patients, along with that seal of quality, gives them a huge competitive edge that attracts both insurers and, you guessed it, more patients. And hey, let's not forget about the staff, the doctors, the nurses, everyone working there. For them, NABH really means one thing: clarity. It replaces potential chaos with clear procedures and really well-defined roles. And this structured environment, when it's backed by better training, it just fosters a culture of professionalism and seriously boosts morale. And we all know that a supported, organized staff is the kind of staff that can provide the best possible care. It truly is a virtuous cycle where everyone wins. And this impact, it doesn't just stop at India's borders. NABH is a member of IASQA, which is the International Society for Quality in Healthcare. Now, what does that mean? It means it has global credibility. It means that these standards are being benchmarked against the very best in the world. And that is a huge, huge factor for India's growing medical tourism sector. And this quote, this really gets to the heart of the matter. For the really great hospitals, NABH isn't seen as some chore or just another compliance checkbox they have to tick. No way. As the slide says, it's a strategic asset. It's a core part of their mission to just be better. And this leaves us with one final and, I think, very powerful question to think about. When a hospital decides to pursue standards like these, are they doing it just to get the certificate, or are they doing it because they genuinely, truly believe in improving patient care? The answer to that question, well, it tells you everything you need to know about where their real priorities are. Definitely something to think about the next time you or someone you love has to make that choice.